BPH, or benign prostatic hypertrophy, is a very common condition in men, virtually as a normal part of aging. Just as a man's hair turns gray and or gets thinner, if not falls out, his prostate gets bigger. Classically, the prostate is described as a walnut-shaped gland that encircles the urethra as it leaves the bladder. As the prostate gets bigger, it pinches or squeezes off the urethra, causes changing in urination. Truthfully, this concept of an enlarged prostate causing bladder outlet obstruction is a bit of an oversimplification. Some men, in fact, have smaller prostates, but there's a dynamic component or muscular tone that constricts the urethra. Conversely, there are some men with huge prostates who claim no difficulty urinating whatsoever. Nevertheless, it is true that in general, men with larger prostates do tend to have more changes and or difficulty in urinating. Fortunately, there are medications that can help to alleviate these symptoms in many men. There are pills that shrink the prostate, others that relax it to improve urination. However, medical treatment may not be the best choice for every patient, and there are several reasons for this. Firstly, medication does not work for every patient. Secondly, some patients have side effects that are intolerable or at least outweigh the benefits. In particular, in these economic times with rapid decreasing healthcare benefits, including rises in deductibles or copays, chronic medication can be too costly. Lastly, for some men who do not want to take a pill every day for the rest of their life in order to urinate, there are alternatives. The good news are there are several procedure alternatives that preclude lifelong medication. 2 are typically done in the hospital and 2 are done in the office. TURP, or transurethral resection of the prostate, has been the gold standard for years. Patients call this the ream job or rotor-rotor. Think of the prostate as a bagel or donut with a hole in it, that as the prostate gets bigger, it pinches that hole off. The TURP involves placing a scope into the prostatic urethra, scraping out the tissue to make that hole larger. Advantages include the fact that it leads to an excellent improvement in the force of stream and most other symptoms, and the symptom relief is generally long-lasting. Disadvantages, however, require that it requires anesthesia, hospitalization, typically overnight, sometimes 2 days. Because it can be somewhat bloody, it requires refraining from strenuous activity for several weeks. Now there's a laser TUR, or photovaporization of the prostate, where the scope is placed in, but now laser heats the prostate, which virtually disappears immediately. Advantages include that this is less bloody, so therefore can generally be done as an outpatient, yet still leads to TURP-like results. Most patients go home the same day with a catheter overnight, which they can take out the next morning. Because it's still somewhat bloody, you still need to refrain from strenuous activity, though generally for a quicker period of time than a TUR. Some patients, in fact, can have this done in the office, during which time the prostate is numbed up, much like using Novocaine at the dentist. There are also 2 office-based minimally invasive procedures that are very attractive. One is microwave therapy, involving placing a catheter into the bladder. A coil emits microwave energy that heats that inner prostate, killing some tissue, ultimately leading to a wider opening. It typically lasts 45 minutes or less and can be quite comfortable. 2 machines are available depending on the prostate size and the patient's symptoms. Advantages include that there is only oral medication for mild sedation. There's no IV, no major anesthesia, no hospitalization, and this in turn can make it less costly to the patient. There's generally a quick return to full activity. Relative disadvantages include the fact that it does require a catheter for 1 to 2 days, potentially 7 to 10 days, depending on the machine used. It's very safe, though the process evolves over time, and therefore the full effects may not be realized for 4 to 12 weeks after the procedure. Lastly, another office-based procedure is transurethral needle ablation, TUNA, recently renamed Prostiva. This involves placing a scope into the bladder, and 2 tiny needles like cobra fangs poke into the prostate, where radiofrequency waves are emitted and heat the prostate for 2 minutes and 20 seconds. Most patients require 5 such sticks, so it's a 12 to 15-minute procedure. Once again, the advantages are that there are no IV, anesthesia, no hospitalization, a catheter is placed for less than 24 hours, or in some patients, no catheter whatsoever. Once again, there's a quick return of full activity. The relative advantages include that, similar to microwave therapy, the tissue changes evolve over time. Therefore, the full effects may not be realized for the first 4 to 6 weeks and may continue to improve up to 3 months after the procedure. So in conclusion, benign prostatic hypertrophy, which causes bladder outlet obstruction, is a very common condition as men age. Fortunately, there are very attractive procedural alternatives to medication that can lead to an improvement in the man's quality of life and preclude the need for lifelong medication. Thank you.